Hi, this is Alina Fish from Action Physical Therapy. Today we're going to go over 3 simple tests that you can do at home and check your rotator cuff. If you're having shoulder pain, if you're not sure what's causing it, these are 3 things you can do to check if you have a rotator cuff injury. And that they're pretty simple, pretty straightforward. So the first one is, we call it the drop arm test. What you can do is raise your arm to the side, just like that. And if you cannot do that, then have someone else help you raise the arm to the side. Now, try to lower it down in a very slow and controlled manner. If you're not able to do it, if it hurts, the arm drops to the side, causing pain, then there is a chance that you might have an injury to one of the rotator cuff muscles called supraspinatus. Another test that also tests for the same muscle, supraspinatus, and that's, by the way, the most commonly injured muscle of the rotator cuff, we call it the drop arm test. So you're going to raise your arm not exactly to the side, not exactly forward, but slightly diagonally, and then what you're going to do is turn your thumb down. The empty can test. If this is causing you pain, that's an indicator of the rotator cuff injury, specifically supraspinatus. If it's not causing pain, if you're able to do it, have someone press on top of your arm and resist. Try to resist. If you have pain with resistance, again, that's an indicator that the supraspinatus might have a problem, might have a tear. And the third test is the one when you put your arm behind your back and you're gonna lift it off just like that. If it's causing pain, if you're not able to do it, again, it's an indication of a different muscle problem. It's called subscapularis. If you're able to do it, have someone press against your arm and your job is to resist. If you have trouble doing that, that means that you can potentially have a rotator cuff problem. Now, here's what you need to consider. Usually, a rotator cuff tear starts very gradually unless it's a traumatic tear. So if it's only 5 to 10% of the muscles that are injured, what happens is you start having pain and people continue with exercises, continue with doing their daily activities. They don't slow down, they don't stop, they don't take care of it. The tear will progress. It will progress to the point where you will need a much longer treatment or possibly even surgery. So if you're having pain, please don't wait. The number one mistake that people make is that they don't do anything. And they try to ignore it. Do not ignore it, seek help, and we will be happy to help you out. You can call us and we can do an assessment of your shoulder and let you know if it's a rotator cuff or something else, and we can tell you what needs to be done to get better. So our phone number is 215-947-3443. Hope it was helpful. See ya.